thank you for inviting me for giving this talk about managing routine medical checks and other regular requirements in Prader-Willi. I just want to say, you already said that I'm a pediatrician, and also I have to mention that I have treated many children and adults with Prader-Willi, and besides in my family, I have two sons, now 44 and 42 years old, and the youngest has Prader-Willi. And he has been living, I have to say, the last 22 years in a home, a specific home for Prader-Willi in Denmark. So as you said, also my activities related to Prader-Willi, I have been in many kindergarten schools and homes for Prader-Willi and talked about Prader-Willi, and we have in Denmark, I have to say, an advisory board in our association since 1996, and we are all kinds of professionals. We meet 2 times per year, and everybody can contact us if they want. And then also I'm involved in IPWSO, as you said. So this presentation today is that I'm going to focus on the body. What to know when you work with Prader-Willi, and what to know when to secure the needed daily help. And to be aware of special abnormalities that a person might have, perhaps not talked about or noted before. And to know what can give rise to serious situations, also health situations. And about food and diet and physical activity. These are very important subjects, but it's not the main subject for today. And I recommend the previous ECHO sessions for caregivers by Constanze Lemmer and Georgina Lonan about nutrition and about exercise. And you can go to the IPWSO website and find these presentations where the details are talked about both food, diet, and physical activity. So I take the other things. So it's something from a medical person's point of view. It's compared to other syndromes. Congenital malformations of organs is rare, and it's often seen in other syndromes. And children are born floppy after normal pregnancies, and parents are healthy. And symptoms in Prader-Willi are caused by lack of important genetic signals from chromosome 15. And all symptoms that we see are related to dysfunction in various areas of the brain and in the so-called autonomic nervous system, which is the nervous system outside the brain that regulates functions in the organs. So the children with Prader-Willi, they are born with all normal organs, including muscle cells, but the regulation of the organ function from the nervous system is the problem. And it affects glands, muscles, intestines, sensation, temperature, and cognition. So the brain is different in many ways in Prader-Willi. The regulation of hunger and satiety, for the body, the biggest problem that we stand with, the temperature regulation and feeling of temperature and the pain sensation are often affected. Motor development and functions are affected. Balance is poor often, and body perception is often not normal. So scans of the brain will show when parts of the brain react differently to normal. For example, at sudden changes of plans, nerve cell activity in the brain is different to normal. Also, connections between nerve cells in the brain are different or less. And then again, the autonomic nervous system is affected. And what is the autonomic nervous system? We have to focus more and more on this, but it works without your own control, and it regulates many body functions. It's divided up to the sympathetic and the parasympathetic system. And it is the stimulating system and the inhibiting nerve system to the organs. It regulates the stomach and intestines functions, the urinary tract, the level of stress, the blood pressure and circulation in organs and skin, and the sleep, temperature control with diseases, the well-known thing that you can have fever or no fever with diseases, and also your own sensation of temperature for warm and cold. So there are many medical problems in Prader-Willi, as I say, both because of the syndrome itself, and this we can treat. Many of the problems we can treat, but we also see diseases arising after years when medical needs are not known, and this we can prevent actually. And then again, the problems coming because of overweight in Prader-Willi, which we can prevent. So I just want to tell about a rather recent investigation that was published from the Netherlands. It was an investigation about 150 adults with Prader-Willi, and it showed that 70 had one non-diagnosed physical problem that was possible to treat. 22 had 2 undiagnosed problems, and 10 had 3 or more undiagnosed problems. And here it was also looked at how they lived. 26 lived in a specific Prader-Willi home, and they were 21 to 32 years old, and with a BMI 22 to 30. 36 in a non-specific Prader-Willi home. They were a little older, as you see, and had a somewhat higher BMI. And then 19, the youngest, were with parents, and they had different BMIs from 26 to 36. So in general, in this investigation, it was shown that the eldest and those not living in a specific Prader-Willi home had more diseases and also more undiagnosed physical problems. And those living in Prader-Willi homes, there were more contacts to dietitian, more plans for diet, and they were in general more physically active. So when we look at the body, then we have to see what we can see with a scan, that muscles and bones are slender, fat layer is bigger than normal, also with a normal weight. And a DEXA scan of the body will show the body composition. Spontaneous muscle activity is often less than normal, and therefore the calorie needs are primarily based on muscle volume and activity. And the result of all this is that the calorie needs are lower than normal. So what is recommended is to calculate calorie needs based on height and not on the weight, and then adjust the calorie supplements or the food, change the food after weekly weights. So about the hypothalamus, is a small gland that regulates so many things in our body. And we have in Prader-Willi a hypothalamic dysfunction, and it gives many hormone deficiencies. Hypogonadism, which is something that we talk about in the adults, it means that the body does not produce sex steroids normally. And this is a typical Prader-Willi thing. So the men have often low or very low testosterone in their blood, and women low estrogen. And if you have a blood test, you can show if supplements are needed from puberty age. It's there that you start the supplementation. Hypothyroidism is often not noted, but it is when the thyroid gland here on the front on our neck produces too little hormone. Then you first of all become tired, not overweight, but tired. So, and it's seen in 10% of adults with Prader-Willi, and blood test will show if supplements are needed. And then about growth hormone, very much talked about, and since year 2000, it has been recommended for children with Prader-Willi in many countries. Growth hormone is important for growth and muscle development, but it does not change appetite. I have to repeat it. And it cannot prevent overweight. Only a diet can. Many children with Prader-Willi have been diagnosed with a total or partial growth hormone deficiency, and growth hormone treatment has secured a better growth. We see that the youngest with Prader-Willi now are much taller than they were years ago. And there's a debate now going on if growth hormone treatment should be continued in adulthood. And then there are differences between countries about what to do with this. This is an ongoing discussion about this now. Then we often see, I'm sorry to say, type 2 diabetes mellitus in Prader-Willi, and it comes because of overweight, and it can be seen already in teenagers. And the treatment is weight loss, diet, tablets. In some cases, insulin is needed. And in many cases, only weight loss can be enough to cure. Diabetes mellitus is not something just that you note. It can actually cause damage on eyes. You can become blind, and you can have a kidney failure, that you lose your kidneys, and circulation can be affected, and you will die earlier than else. Sleep in Prader-Willi, another problem. Regulation of sleep can be abnormal. And I have to say here, all that I mentioned, it's not all with Prader-Willi, but it's something to be aware of, all what I talk about. So I have to say sleep regulation can be abnormal, but it's not in all cases. Sleep apnea is coming. It can be central, means regulation of sleep and breathing during sleep from the brain, or obstructive, and obstructive apnea is caused by two big tonsils that the air cannot come to the lungs in a normal way. It can be treated with a face mask during sleep, and it has helped many as a face mask if needed. Daytime sleepiness can be because of disturbed sleep during night, and a sleep study can be a possibility. So if you have any speculations about that, ask your doctor if you want to know more about this. Temperature abnormalities. Many can have even severe infections without fever, and often a reason for delayed treatment, even a reason for sudden death. We have to say that. So the recommendation is that you have a document ready for your doctor about this. Consider always the person's attitude or condition. Are there any sudden changes? Not because of any behavioral problem, but you can see a change in the body function, and also about choosing clothes. When the person cannot feel warm or cold themselves, you must guide about which clothes to use on a given day. And then calcium and vitamin D is very important for the bone. And vitamin D deficiency, it has been observed in many countries, in many investigations. And also in the Dutch survey mentioned here before, they noticed that treatment of vitamin D deficiency generally gave a better health. So the recommendation is to measure vitamin D level in blood test and give supplements every day, 10 to 25 milligrams per day, all year round, all the life. So what's more to be aware of? Vision, hearing, mouth, teeth, chewing, swallowing, stomach, intestines, and they do not vomit usually. Urinary system, heart and lungs, back, legs, feet, skin, hygiene, and body perception. So about the registration of symptoms and changes. It is the caregivers who are the responsible. Many with Prader-Willi, they do not feel changes in their body function, or they do not talk about it, they do not complain. And sometimes complaints can also be because of needs of attention. So the situation can be difficult. Is it a real problem, or is it something that they invent? You can see both situations. So life can be difficult for all, but you have to know the person very well. So about vision and hearing, many have a squint. Many are operated for that in childhood. It also something about the muscles regulation, the position of the eyes. Many need glasses. Vision can change also in young adults, especially vision can change after the age of 40, as with all of us. So it's recommended for all that you check the vision every second or third year. So about hearing, strange enough, no research has been done about hearing in Prader-Willi, but the impression is generally that hearing is often good. recommended is that you check the hearing when there are speech problems. It can be a reason, and especially also after age of 50, because all can have a worsening of hearing with old age. Mouth, teeth, and chewing. It's a problem that we have to focus more on. We know that there's a little saliva, often dry mouth, teeth are not cleaned normally by the saliva. And food remains on the teeth after the meal. We often see that. And another problem, perhaps not recognized so much, is that there's often a reflux of gastric acid. And they do not complain about it because the sensation of it is not as it would be in you and me, but it harms the teeth. Chewing, motor function can be poor. Some, they chew with an open mouth, and some swallow big pieces of food. And swallowing can be incomplete, and the muscle function can be poor, so that food remains in the mouth and esophagus. And this all means there's a risk of choking, and especially if the person tries to eat quickly, also if the person has stolen some food. So a recommendation could be that when you have finished the meal, you give half a glass of water to, so to say, to let the things go further down. About the dentist, check is recommended every half year or more often if the teeth are very harmed by acid, especially to check the acid harm on the teeth. And also be aware that some try to ruminate, means that they try to have the food that they have swallowed, and then they can press up the food from the stomach. It's seen, and it harms the teeth because what comes up from the stomach is very filled with acid. So all this about the eating situation, in general, it can be recommended that people with Prader-Willi do not sit alone eating, especially if chewing and swallowing is observed as not normal. And we know that choking is a well-known cause of death in Prader-Willi. It is seen every year. Stomach, another problem can it be? There's often the reflux to the esophagus, as said, eventually unrecognized, and you can see inflammation in the tissue of the esophagus. And the stomach can be easily distended in some cases with overeating, but also with gastroenteritis. And it is distended because vomiting is very difficult when you have Prader-Willi, and you should never try to provoke vomiting with medications if you suspect that the person has eaten something wrong. And a distended stomach can be rescued with a tube. It can relieve the pressure. And if it's not done, sometimes you can have a hole on the stomach wall and it can cause a sudden death. So there are often few complaints with a distended stomach. The only observation can be that the person does not want to eat. And if a person with Prader-Willi does not want to eat, and if it's not because of some behavioral situation, then the red flags should go up. It demands immediate medical evaluation, and often with an ultrasound scan. And we have many situations also published where caregivers insisted on having a scan, and there was a hole on the stomach wall. And in the beginning, the medical staff did not suspect that. Intestines. We know that the passage time from the stomach and further down is often slower than normal, and it can cause constipation. And sometimes the constipation is not known by the caregivers or the parents. So when referred to hospital because of distended stomach, we see that many also have constipation. And rectal picking can be a problem, and it sometimes starts because of constipation. They try to dig out the stool. So it's recommended to be aware of time of toilet visits. And if you suspect constipation and if there are any problems, talk with the person if you can see the stool, and then consider the needs of laxatives. And always talk about this with the doctor. So here you have this well-known picture, and it should be a type 4 stool. Urinary system. Most children become continent actually, but incontinence can come with overweight and constipation. And rare toilet visits to urinate, it's actually often reported. It's not written so much about. But when asked, they often say that they do not feel a full bladder. And we have done scans, ultrasound, and can see a full bladder, and even the person does not complain of having a full bladder. The bladder can become very distended. And sometimes we see that when they are at toilet, they deliver a very big portion of urine, and sometimes it comes out slowly also. So in many cases, it can be recommended to have a plan for toilet visits, for example, before each meal and before bedtime. Heart and lungs problems comes with overweight, to say it briefly. For the heart, you get elevated blood pressure when you're overweight, and the lungs with severe overweight, it can be difficult to breathe, and you will get edema in the lungs because of severe overweight. Bones, from beginning, they are slender. Osteoporosis, fragile bones, is often seen in adults with Prader-Willi, especially with vitamin D deficiency and inactivity. And this, again, a DEXA scan will show if there is osteoporosis. Bone fractures can therefore be a risk, and most often complaints are few with a fracture because of the high pain threshold. So it's recommended, and you have to insist, always ask for X-ray when a fracture is a possibility, even if the doctor does not expect it, because if they touch the broken leg, sometimes the person will not feel any pain. But the only symptom can be that the person does not use an extremity, and you see swallowing, signs of blood, and there has been perhaps a reason for. About the back, what we see here often in Prader-Willi is the kyphotic spine, overbent, or the scoliosis, the S form of the spine. It comes because of Prader-Willi. It might be because of an incomplete muscle function in the back, but we see it and we look for it, and many are operated as teenagers. And again, look for it. In a Dutch survey, many with scoliosis were not diagnosed, and it can give rise to muscle pain in adulthood, inactivity, sleep problems, also if severe cases, breathing problems, and actually also adults can be operated on in some cases. Feet and legs, we are going down. Swelling legs and edema. Edema comes with overweight, and treatment is weight loss and walking, not diuretics. Diuretics is recommended if you have too much fluid around the heart, but not in the legs. It will not cure, diuretics will not cure edema in the legs. It comes because of overweight and inactivity. And it can, if you have edema in the legs, you can have there can come leg ulcers, and they can be infected, and penicillin can be needed. And about the feet, just a thought, many need help to cut their toenails. And sometimes this is also overlooked, and it's a pity, I think. You can have a person that comes every second week and take care of the nails. Shoes, sometimes special soles or support in the shoes are needed, and it can help to better motor function if there are special soles and special shoes. We see it often that people have a wrong position of their feet, bent to one or the other side, supinated or pronated, as we say. And here, if you have more focus on the shoes and give the right shoes with the right soles, the motor function can be helped a lot. The skin can be fragile and often need extra care. So skin picking can be a severe problem, and it often arises when a person is bored or stressed. It can be a habit that is difficult to stop. So it's recommended for busy hands, have something to tear up. And we see in some Prader-Willi homes, when they have something to tear up, skin picking can be prevented. And then also take care of the skin, avoid broken skin and scars. A few words about hygiene. Many need fixed rules. Not all will understand the background, but it can be learned. Like you can teach small children rules about hygiene. It can be needed to have a fixed plan for changing clothes, bath, time and bathroom. A timer can be needed in many situations. And many need help with hygiene at bath, amount of soap, washing, cutting nails, combing hair, etc. But very much can be learned, actually. And if not learned in parents' home, it can be learned where they come to live when they are adults, but it can take some time. Psychology in Prader-Willi. Behavior and psychology is another important subject. And it's needed, a special care is needed when introducing routines for taking care of the body. It has to be done gently and with careful knowledge of the person's understanding and cognition. So just small advices that many of you know, but use illustrations to describe and be sure that information is understood. Not only told and they say, yes, yes. What is seen in Prader-Willi is remembered, and what is only told is very easily forgotten. And it is a typical Prader-Willi thing. It's not something that I invent. And reasons for instructions are not always understood, but it can be learned like you teach a 3-year-old to wash hands before meal. Example is hygiene rules like washing hands before meals, for example. So summary of all this. What we recommend here in Denmark is medical visits every half year. And there you have weight and blood pressure measured. You have evaluation of heart and lung function, evaluation of back, legs, feet, skin, and talk about the sleep, and also talk about the intestines, of course. And then blood test every year or every second year for vitamin D, thyroid hormones, and for sex steroids if needed, or treatment is given. Even if you give supplements, you also measure the sex steroids in the blood. And individually evaluated for other tests. And if you give psychotropic medications, there might be need for other tests also. And more recommendations. Dentist every half year, and then check vision every second, third year, and then hearing test when needed, and especially after age 50. And then, of course, all the other help given when needed about clothes, hygiene, cutting nails, etc., etc. So you can always remember to go to the IPWSO website. And there is here the guides for doctors, consensus documents, and you can print these documents and have it ready for all medical contacts. And there's also information for professional caregivers on the website. So I just want to say thank you, and I'm looking forward to see you all in July in Ireland. Thank you. And there you have my son. He was visiting He loves dogs and he was visiting a friend with a dog. Thank you.